Whoever said cannabis wasn't harmful certainly hasn't been a professional in the field. Over the past year, for example, I've had alone over 7 people who have had a substance-induced psychosis as a result of heavy cannabis use. By the heavy cannabis use, I mean 8 or 9 times a daily. COVID has wreaked havoc on our young people. And when I talk about a substance-induced psychosis, I mean people hearing voices, having distorted thoughts, thinking that there's something coming after them. I also mean that they can erupt in very, very violent behaviors, kicking through windshields, kicking down doors, being incredibly argumentative, and families are beset because what they are watching is their wonderful loved one turn from someone that they know into someone that is very frightening. Having a substance-induced psychosis is much more common than any of you think. And as we've experienced an increase in cannabis and an increase in other street drugs, we have seen it rise this year, as you can certainly check out for the Center of Disease Control or the American Medical Society. Well, what are some of the signs that you look for? All of a sudden, your loved one is in their room. A lot of times we hear of young adults in their rooms, smoking 7, 8 times a day, doing video games, not coming out, not going to school, just barking, barking, barking at their loved ones. This is very confusing for family members and loved ones. They don't know how to respond. They actually think sometimes they've done something wrong, but then all of a sudden their loved one may experience paranoia. They may see things, they may hear things, they're not there. It is fearful and frightening. Early intervention is important. However, at times, families and loved ones are really feeling a lot of fear. They're afraid to act. They're afraid they'll lose the love of their loved one. They're afraid of the stigma attached to having a mental health or a substance abuse problem. Our team works diligently, hand in hand with them, to help them navigate that situation so that the loved one can get the help they need, which oftentimes is hospitalization first and residential treatment center, so they can be what we call psych stabilized and move forward with a life well lived.